Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. We're talking today about addicted to natural pain relief. If you're going to be addicted to something,
that's a very good thing to be addicted to.
Natural pain relief.
Yes.
And this is the time to do it. There is a lot in the news, a lot in the healthcare about
first
pain
off, Prince. Mm-hmm. It was found out that he died from opiate medication. Okay. And it was actually prescription. So, right here we have a painkiller that caused the death of a beloved musician. Mm-hmm. So, it's very much in the forefront. It's a very big problem that we have going on right now. And, there needs to be a very strong push on getting these problems solved. And it's a very big concern for the healthcare industry, for the government. They've made a very concerted effort to try to address this problem. Mm-hmm. So we want to do our part.
Yes, and Dr. Prather, how many Americans suffer with pain?
Well, in 2012, they did a national survey to find out, was the last time that they did it. And this is sort of classifying people in different categories. 17%, at the time that they did the survey, 17% of all adults had had a severe headache or a migraine in the last 3 months. 15% had had a severe pain in the neck. 29% had had a pain.
And that wasn't just their mother-in-law.
No. 29% pain in lower back. Mm-hmm. 5% had facial or jaw pain. 22% of adults were told that they had had arthritis. And then 28% had chronic joint symptoms. Where not the lower back or neck, but elsewhere. Mm-hmm. So you're talking about quite a few people are suffering with pain.
Yes.
It's a major problem, and it is a something that needs to be addressed. And we've tried to address it with our healthcare system, and we haven't done that well.
Well, what was the way that was recommended to treat pain?
Well, until recently, 1999, there was a big push that we weren't really addressing pain, that it had become a chronic problem, and people were suffering needlessly, when we had options along those lines. So there was a push, there was some research studies done that suggested that we really need to address pain, and so painkillers, and the leading type of painkiller are opiate-based, should be increased to try to handle the pain epidemic.
This is what they said in 1999.
Yeah, that was sort of where they had decided to really go after pain and address it in a much more complete type of way. So that was the thought process along those lines, is let's increase our pharmaceutical attack along those lines and get people out of pain.
Mm-hmm. Okay, and how did that work?
Horribly.
Yeah, we're seeing the consequences, aren't we?
We are. The solution that was coming up with has been pretty well decided as a complete disaster. We have actually created a much worse problem than what was going on before.
An addiction problem.
An addiction problem, a death problem.
Death, yeah.
People are dying because of it. Mm-hmm. The interesting part about even addressing the pain is that there are consequences to taking prescription medications, not just on the addiction, death, but when you use opiates for a chronic type of problem. Opiates are excellent for end-of-life type of cases, post-surgical short-term types of things. That's it's again a wonderful panacea to humans' ails. But any type of a chronic type of condition, it is absolutely a complete disaster. Because as you start on the opiates, we have opioid receptors that are, in other words, our body naturally produces opiates to help handle pain. And not only have we had from 2000 to 2014, we've had 500,000 people die from opiates. Prescriptions.
Wow. Prescription opiates.
Not illegal. Mm-hmm. Prescription opiates. Mm-hmm. So we're having people die. Mm-hmm. And then what they found is if you're using pharmaceutical opiates to handle pain, your ability to handle pain decreases. And very soon the opiates don't work. Mm-hmm. And the ability of your own body to produce the natural pain relieving opiates is gone.
Wow.
Much reduced. Your the opioid receptors are damaged, and you are in a worse pain situation than when you started. Mm-hmm. So, using opiates for chronic pain is not only a disaster in the addiction, death rate, the going to illicit drugs. I mean, that's the main reason that people go into start utilizing heroin. Is they first almost always start out with prescription opiates, and then your ability to your pain level is worse.
And you get constipation.
And you get constipation.
Now they have a medication for constipation. Oh, my gosh.
Right. So you are in a worse position than if you had never taken pain medication in the first place.
So what are opiates specifically? We talk about, opiates and their effect. And
right.
Now we're seeing an increase in heroin use. Is there a connection between them?
Yes, heroin is a natural opioid. Mm-hmm. Some of the most common, lower dose. I mean, the highest number of opiates actually prescribed are oxycodone and hydrocodone. Okay. But there's a whole list of different types of opiate types of medication.
But those are the ones that are used the most.
And those are the most common ones. And those are actually the highest number of deaths that are prescribed because those are considered the lowest. Mm-hmm. Fentanyl and some of the other different types of higher dose opiates. But it's actually the lower dose, oxycodone and hydrocodone, that most of the deaths actually occur.
Wow.
So, it just because you're taking a low dose of opiates doesn't mean that that's actually a safe type of thing to do.
Now, how many prescriptions for pain are written per year?
There are 238 million prescriptions for pain written every year in the United States.
In the United States?
In the United States.
How many people are there? Oh, my gosh.
It's almost a prescription for every man, woman, and child in the United States.
Someone's taken mine and yours.
The United States only has 5% of the world's population. We consume 80% of all pain prescription medication.
Wow. That's just,
It's mind-blowing.
Yeah, it's mind-blowing. It's hard to wrap your head around
and
that.
Who actually, there's different types of patterns along those lines. The people who prescribe opiates, the doctors, are usually doctors who are overworked. Mm-hmm. Will write prescriptions for opiate medication much more quickly. Mm-hmm. The older the doctor is, the more likely he is to write a prescription for opiates. So there's a lot of inconsistency on, who gets who's prescribing the opiates. So there isn't really a
people
fast...
coming in and demanding it.
And people are coming in and
demanding it. Because that commercial
it.
told me. Now I might die or get addicted to heroin, but,
Sure. And
give me my opiate.
We have a real crisis that is going on, and it needs to be addressed.
When we come back, let's talk about what has the government done to curb this epidemic. You can win a free 60-minute massage in a relaxing spa at the Prather Practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, what can a new patient expect when they come into your office?
The first thing is that's extremely important is a consultation. That's really where everything begins.
And that consultation is complimentary free. They can come in, and the consultation's with you, which is nice.
Yeah, the consultation is absolutely critical. Matter of fact, you can get 90% of your diagnosis just from the consultation.
Listening to the patient.
Finding out what their concerns are, what needs to be done, how we can best help them. Having a good understanding of the complaints of the patient is absolutely critical for good care, and the patient knowing that we are actually listening to them. We have very thorough intake forms that are extremely helpful. Gives us quite a bit of information of what's going on into the system. After the consultation, you have to look at the diagnostics.
Okay.
You first have to understand, where the patient's coming from, have an idea, but then you have to know, what to do, what the problem is. There is a difference on our diagnostics than from the medical diagnostics. The medical profession, as a disease care-based program, they are looking at disease states and combinations along those lines to treat the symptoms. Our basis of our care is a understanding of what is the underlying cause, finding out what that is, usually caused by a break from homeostasis. And you're going to hear that word if you're listening to our radio program.
You're going to know
every
it well.
Time. Because homeostasis is the basis of our practice, and homeostasis is the basis of health, and we are a health office. That is what a structure function office is. So the diagnostics are extremely thorough, probably more thorough than what you would get anywhere else. We look at very extensive blood work. We might do hair analysis, might do some evaluation of the gut, because that's so important to one's health. We do a thorough cardiac evaluation. We do a thorough musculoskeletal exam. Many offices that even are into natural health are either just dealing with the functional aspect or they are just dealing with the structural aspect. We are unique in that we deal with both, and both of them extremely thoroughly and extremely well.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
I feel good. I knew that I would not. So good.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about addicted to natural pain relief. And Dr. Prather, you've been sharing statistics, how many people are in pain here in the United States, and then you said 235 million prescriptions.
238 million.
38 million. I couldn't read your writing.
Very close. Yes.
What's 8 million?
I know.
But prescriptions were written for pain.
Yes, and that was in 2012.
Wow. Okay, well, what has the government done to curb this epidemic? I know there's a lot of things in the news.
It is a crisis, and we're losing, people, loved ones. People are dying. So this is a crisis that came to the attention of the President of the United States. He did call for a national drug control strategy.
Not Doug, but...
Yeah, Doug. Yeah, we're trying to control Doug. But we have a drug control strategy. What are we going to do about this crisis? So 2010, there was this huge... the top minds in the United States got together, in the world actually, and said, okay, this is our problem. What do we do about it? So they came up with this whole strategy that they were going to educate the physicians. They would change the policies. They would also try to educate the public to try to get this under control. There was a increased drug enforcement that was empowered. And there's a very strong attempt to try to stop all the deaths that are occurring. And then there's a concerted effort to change the way that we handle pain.
Okay, and how effective have their efforts been?
Really bad. Unfortunately, when we're talking about the latest statistics were back in 2014, so this is 4 years after the conference when they were trying to get things under control. The deaths for prescription rate has actually increased. 2014 had the highest level of increase of related deaths to pharmaceuticals. There was a 14% increase in the number of deaths in 2014. Heroin, which almost everyone first starts out with, with the pharmaceutical route, and then go into heroin because it's cheaper and easier to get.
Wow.
Oftentimes than the pharmaceuticals. From 2013 to 2014, there was an increase of 26%. So in 2014, there was 10,574 deaths over heroin overdose.
Wow.
Even with the increase in the naloxone on trying to stop the death rate. So better treatment, but we're actually losing more and more people. So the addiction rate is actually increasing based on the number of deaths that are occurring. So we are losing the war.
And people are profiting,
Yes, and there are people who are profiting, but it has become such a major problem that even the pharmaceutical industry is like, wow, this is really bad. So even the people who are profiting are kind of in shock over the whole situation.
Well, not the heroin dealers.
Right.
That's who I'm thinking about.
Yeah, I understand.
Right. Taking this. So what are the solutions?
Well, that's one of the things. We're making some very strong attempts on that, but one of the things that is going on is that there is a emphasis of, well, if this isn't the right strategy, what is the right strategy? And in our opinion, and what a lot of people are actually thinking, is that structure function can really be an answer to this healthcare crisis. One of the things is understanding that and seeing how that can actually be brought into this whole mix as a means of getting this whole crisis under control.
So this strategy, this structure function care, is it supported by evidence-based standards and by credentialing services?
Yes.
Yeah.
Yes, it is. One of the things that has been done is the major credentialing center for hospitals and independent clinics has actually come out with a statement on the best practices. That's one of the things that is a very, very important type of way that we need to base our our care off of what are the best practices. And there has been a shift on what is the best practices. In other words, you should never start out a pain situation unless it's a end of life or cancer or a short-term type of post-surgical. Should never start with opiates. That should not be the standard of care at all. Standard of care should be now switched more to structure function care. And the recommendations along those lines now are chiropractic, acupuncture, auricular therapy, very excellent type of way of doing it, working along with soft tissue work, massage, manual therapy, looking at natural stimulators, also nutritional, homeopathic types of means of actually addressing these things. One of the best ways that we actually offer along those lines is something called P-stem, which is a part of auricular therapy. It's something that we're getting some amazing results with. So there are some, and what's also very interesting is that the results of these particular treatments have been shown as effective as opiates for pain relief without any of the negative effects.
Well, and probably long-term, right? Because the opiates would, you said, destroy the pain receptors.
Certainly. So you get the same effect on a short term, but long term, I mean, it just completely blows away the opiates. Because the natural treatments increase the body's capability of handling their own pain. So long-term type of use. Short-term, it shows as effective. Long-term, it is much, much, much. How many muches can I do? Better results.
So these treatments work, more of these natural treatments, and we're going to go into them more specifically. Why do they work?
You're dealing, there are two different ways of actually approaching it. When you're talking about, you've got the difference between disease care and structure function care. And disease care is you're taking care of the symptomatology. The structure function care is you're bringing the body back into homeostasis, which is balance. And as you do that, the cause of the pain is gone. So you're dealing more with the cause instead of the symptoms.
Going to the root of it.
You're going to the root of it, and as you correct the root, then you can get the pain under control. And quite frankly, in our office, we see the results pretty much immediately.
Yes, and I was thinking of the woman that found us on the internet, and how long had she been on opiates? And
16 years.
16 years. Her doctor, what happened there? She was looking for more natural pain relief.
Well, actually what was happening is they had cut her, the levels that she was on were dangerous. Because they had been increased over those 16 years because they became less and less effective. And her physician had looked at that, and with the new guidelines that come out, had said, I legally and ethically cannot continue on this level of pain medication. It was life-threatening. It was not helping her, and it needed to be changed. So her medications had been cut by a third, and she thought she was going to go crazy. It was, you were having one withdrawal. The pain level was unbearable. She didn't know what to do. She had seen that we had a natural way of treating the pain, and was desperate to come down. Actually, came down from Muncie down to our office, and started treatments. And she's a different lady.
It's been 3 weeks, and she's a different lady for sure. And that was through chiropractic?
Chiropractic, we did some manual therapies, some electrical stimulations, combination along those lines, and saw an immediate difference.
And then she just started her first unit of the P-stem,
Correct.
which has been really helpful.
Hugely helpful.
So why is a combination of treatment more effective than one single treatment?
And that's one of the things that is something that's been proven very true. We get a certain amount of relief with the chiropractic, a certain amount of relief with acupuncture, a certain amount of relief with working auricularly with the P-stem, with manual therapy, all those different types of areas. But each of those areas work on different aspects. You know, you are looking at the chiropractic for alignment of the skeletal structure. Then you're looking at acupuncture, which is excellent for inflammation and increases the body's own ability to make opiates. Is one of the things that's been found to be true. Auricular stimulation is a direct result on treating pain centers in the brain, so it approaches it from a completely different type of standpoint. You have a lot of different types of aspects that go into your pain symptom, pathology. And as you can address each of those, you multiply the effects, not just even add the effects.
Okay, when we come back, let's talk more about addicted to natural pain relief. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
Here's some political news here. President Obama just had his annual physical, which showed that he's suffering from some pain in his right foot. When asked why he doesn't get it treated, Obama said, "It's not covered by Obamacare."
The Prather Practice would like to invite you to a special open house event on Tuesday, June 21st from 4 to 7 p.m. at the Prather Practice, located at 8902 North Meridian Street. If you desire to find a healthy way to relieve pain, restore function, and relieve stress, this is a great opportunity to find services that will help you to feel better and get healthy. You'll learn about our state-of-the-art therapies, including acupuncture, point stimulation therapy, auricular therapy, and chiropractic services. You'll hear a special presentation from Dr. Robert Prather on the importance of relieving pain naturally, and you'll receive a free pain assessment. You'll also get 3 acupuncture treatments for only $59, normally valued at $315. That's the Prather Practice Open House event on Tuesday, June 21st from 4 to 7 p.m. at the Prather Practice, 8902 North Meridian Street, 317-848-8048.
Doctor, give me the news. I got a bad case of loving you. No pill's gonna kill my head.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We're talking today about addicted to natural pain relief, and we use that word addicted. We're a society of addiction.
We are.
Right now. And you were saying 238 million prescriptions, I got it right this time, went out for pain.
Pain, yes.
Here in just in the United States alone.
Just in the United States. And again, we're consuming 80%.
Mm-hmm. And I was thinking the story of our patient that came down from Muncie. A lot of doctors don't know what else to do. Correct. They don't have
a strategy.
The strategy or the solutions.
Or where to send them.
Right. And we do. Here at the Prather Practice, we have the solution, and we see it over and over again.
Correct.
On the pain. It's great. If people have been on opiates, by the time they leave here, they're either been weaned off of them, or they never have to go on them.
Correct.
When I'm doing outcome assessments, after about their second or third week starting care here. Most of them are not taking anything for their pain. Anything.
Correct.
Yeah. So let's talk about those solutions here at the Prather practice, the structure-function model. You mentioned chiropractic. So how does that work to help relieve pain? How does chiropractic work?
Well, chiropractic is the basis. We can get a lot of pain relief through acupuncture, auricular, some of the other different types of things, immediate, but for long-term type of care, you need to fix the underlying problem. And most of the time, the skeletal structure plays a very big part of that. And if the skeletal structure is the base, the base of the structure is off, it's going to be very hard to get someone out of pain. So long-term type of corrective type of care, chiropractic is absolutely essential. We've had physical therapists, you're doing rehab. A lot of people do some very excellent work along those lines. But one of the things that is very evident for yourself doing rehab as an occupational therapist, physical therapist who've worked in here, say how much easier it is to do the corrective exercises, to do the therapies, and the better results that you have once the skeletal structure is back in place.
Oh, yes. I prefer them to get their chiropractic adjustment before they come see us over in rehab when we start the corrective exercise.
Yes.
There's a big difference.
And people are usually on their first adjustment go, wow, that's amazing.
Well, yesterday I was doing an evaluation on someone, and most of her issues are neck and low back pain, and she didn't want to tell you about her foot pain, but you found it out, and aligned her bones in her feet. There are a lot of bones in the foot, and she could not believe it, and she's been dealing with this foot pain for years.
Yeah, 12 years.
Yeah, right.
And she got up and she says, this is the first time in 12 years my feet haven't hurt.
Yeah. So, very effective. Chiropractic is very effective.
It is extremely effective, and it is absolutely essential, to get that type of care, to help everything else work. It's just, I can't emphasize enough the importance of chiropractic in people's lives.
I don't think people realize your nervous system goes right through those vertebrae, and if things are misaligned, there's such an interference.
Absolutely. If the structure is off, the function is not going to be correct. And if the function isn't working right, then you're going to start to produce pain. That's the body's way of letting you know, hey, this isn't right. So chiropractic is a very, very essential, very basis of what we do. And, I'm amazed, still amazed, even after 33 years of its effectiveness.
And people hear all the time, he just knows where my pain is. We're not aware all the time.
Yes.
Of our bodies.
Right. Yeah. We have, pain is a very fascinating type of subject. I could talk for hours just literally on the physiology of pain, which I won't, because most people are going to get glassy-eyed and dazed and fall asleep. But it is amazing, really, how pain works, understanding it, understanding pain thresholds, how the body works along those lines, how you increase the pain threshold, how you bring the body back into a normal type of a pain pattern. There's an awful lot involved in this, and that's why we have multiple ways of working on it, and that's why our effectiveness is so much better than a single type of unit.
Yeah, a new patient was talking to yesterday, goes, this is a one-stop shop. One-stop shop.
Yeah, we go from section to section, and we had one guy talking about how funny it is. We just have sort of this...
And he's figured it out now, the flow.
Where he's supposed to go next. But the chiropractic by itself isn't as effective as adding all the other different aspects into it.
Right. Well, let's talk about acupuncture is one of them.
Acupuncture.
And congratulations, by the way. You made the A1 Best Acupuncturist here in Indy for the second year in the row.
Thank you.
You're welcome.
And yes, I absolutely am amazed by acupuncture, and so is my patients, just how we can get immediately pain relief.
Yeah.
And acupuncture not only provides immediate pain relief, but one of the things that they found for acupuncture is it stimulates the body's natural opiates. So, if the opiates are working for you, the natural ones actually work even better. And also what's interesting about acupuncture that's been proven is that your opiate receptors are improved with acupuncture. Not only do you get your own natural opiates, because it's, I had this one gentleman say, he got up and said, wow. He said, what drug did you have in those needles? And I said, none. It was all what your body produced. But if you hit the right points, hit them in a proper way, your own natural opiates increase. And I said, that's why you've got this euphoric feeling right now. Mm-hmm. He says, wow, I really do. Not only is my pain gone, but he says, I feel really good. And it's a non-addictive opiate that improves long-term and actually increases your pain threshold. In other words, it takes more pain to actually start to reach your brain.
Is there any problems to get addicted to acupuncture?
There are no problems getting addicted to acupuncture. No one's ever died.
Well, let's talk about the next one, because it's usually people's
favorite,
all-time favorite. And they love Justine, our massage therapist, but the soft tissue work.
Yes, and again, we're combining things. We like to make everything work together. And getting in there and relieving that soft tissue in proper ways can just do wonders for relief. It's what I tell all the patients, this is drool time. Because it feels so good. And actually, a lot of people drool during that. It's funny.
That is gross.
Well, you know what I mean.
Yeah.
It's a relief. There's a lot of different ways that we have. We have something called rapid release. We have some stretch and spray. We have specific ways of working with the hand. We also have a lot of liniments that we use for different types of pain. Very effective on this. So when we're talking about soft tissue work, it's not just, again, it's a huge area of how we work with it. There's also some electrical stimulations that we can do. There's a tremendous amount we can do. Well, actually, it is. It's microcurrent, so it doesn't really feel anything.
Right, but
what do you say? The hand work is really remarkable, and so is the rapid release.
Yeah, and we take the patient back to our spa area.
Yes,
so they can relax
and really get in. Yeah,
we're tense. We are tense right now.
Yes.
A lot of people coming in are stressed with work, stressed with family life. We forget to breathe. We talk about that. I had to work with a gal yesterday and keep reminding her to do her deep breathing.
Sure.
Right into that shallow breathing, which doesn't help pain at all.
It increases it.
And when you're in pain, you want to do that. Well, let's talk about P-stim, because it's really one of the state-of-the-art. Insurance is covering it. It's
the future of pain care, and when we're talking about the chiropractic, the acupuncture, and the soft tissue work, we're talking about the direct areas of pain. When we're talking about auricular therapy and P-stim, we're talking about the brain. So where that comes in is not only do you need to treat the area of pain, but then the brain's involved in it, because long-term type of pain actually creates certain types of pathways, and even when you've corrected that completely, the brain could still be saying that you have pain just because it's used to it. So you need to turn off those pain centers in the brain for the pain perception to be gone. But it's not a standalone by itself.
Right.
You need to also correct the problem, not just working on the brain. That's again, but if you, I've had people before we started the auricular and the P-stem who still were complaining about a pain, and their neck was solved, their low back problem was solved, but they were still experiencing pain because their brain was telling them that there was still pain because it had been doing that for 16 years. So adding, again, that's where the total package comes in for the effectiveness for the pain relief.
Because we're working the brain, we're working the soft tissue, we're working the structure,
Correct.
the nervous system.
We're working on the chemistry with the acupuncture. There's a tremendous amount involved with all that.
Well, let's talk about homeopathy and nutritional therapy, too, for pain.
Very, very effective.
Formula 303.
Formula 303, it's one of the standard types of things. There's some very, very safe types of things that you can take for pain that can really, really help out. Understanding how the amino acids, the vitamins, and the minerals all play a part in pain. Once you've had pain for a long period of time, there is a collapse of certain vitamins, minerals, and amino acids. And you need to replace those if you are going to get the whole pain process under control. And that's also one of the areas that we provide here at the Prather practice that is hard to find that combination.
Okay. When we come back, let's talk about the barriers with this epidemic of pain and addiction. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. What conditions can be helped with acupuncture?
Well, of course, the sinusitis, tinnitus. We've had some very severe cases of that came in and had some excellent results. Toothache is excellent. PMS, menopausal symptoms. I have many women who are coming in saying, I've heard that it's excellent for hot flashes. Did some acupuncture, and they said, wow, I'm sold. Just because of the changes that occur with that. Headaches, migraines, acupuncture is an excellent adjunctive to that. Parkinson's disease. I have patients who are coming in with Parkinson's.
Oh, yes.
And actually getting some very excellent results.
You can see their gait gets better.
Sure. There are certain points that we do that are specifically have been shown to be very effective for Parkinson's. I know the National Institute of Health is doing some research on that right now with some very excellent results. I've gotten the points from their research that they've done, started to implement them, and I have definitely found that that's been extremely helpful. Stroke, post-stroke, we can get some very good results on that. Cancer patients. A very interesting study that they did on people who were going through chemo radiation, that they had 80% fewer complaints if they were doing acupuncture. So
when they were going through the treatment.
Also afterwards, there are problems with the nervous system afterwards. All addictions, cigarette smoking, we have a lot of people coming in for that, but acupuncture, specifically working on also some ear points along with that, along with the needle points on the body, actually can have some very, very significant improvement on really almost any addiction. I have a patient who came in just to try acupuncture, was actually in law school, and a lot of stress, a lot of things involved with that. And he just keeps on coming in because he says, I do so much better in school. I'm able to concentrate better. I'm able to relax. It just makes such a difference. There was a gal, whenever she was going through the whole CPA program, to get certified. And every time she takes tests, she comes in for acupuncture.
Before the test? Or
yeah,
after?
She says it's better than Valium, just to, kind of keep everything nice and calm, and I can think great.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about addicted to natural pain relief. And Dr. Prather, what are the barriers that exist right now, in the healthcare industry regarding this epidemic pain and opiate problem?
Well, we're trying to overcome years of negativity towards structure function care, chiropractic, acupuncture, auricular therapy, nutritional products. There was a mindset that was created by excellent marketing and advertising by the pharmaceutical industry, that the pharmaceutical industry had all the answers to our healthcare problems, which helps their sales tremendously. However, as false as that is, we have been pharmaceuticals. Is an important part of our healthcare system, but overused and wrongly used. Pharmaceuticals, when we're talking about pain relief, is something excellent in short-term, acute, end-of-life type of situations. It is not to be used in chronic pain. You need to go through structure function. And one of the things that, it's one of the patients went to their doctors and said, my pain relief, my pain's gone after I went to the Prather Practice. And he said, well, what did he do? I said, chiropractic acupuncture, and gave me some supplements. And he says, well, if you believe that works, then that's fine with me. And the patient felt degraded, that what, I don't know when I'm in pain or not? You're completely discounting my, what the evidence is. But, the medical schools taught that pharmaceuticals were the only answer to all healthcare issues. And that is totally wrong. The way that the healthcare system, not just myself, but by the experts who are really independent, said 80% of all healthcare should be structure function, 20% should be pharmaceutical. And that should be the split. That's a healthy split in the healthcare system. And right now, the 80% of all the care that should be given was taught to the healthcare professionals by the powers that be through TV, advertising, has pretty much permeated our whole society, that 80% is invalid and should not be used, and quackery. It's like I had this one young man who came in. He had been told by his grandmother that these are the things that you should be doing with chiropractic and acupuncture to get your pain down. And his dad and his physician sits there and says, "Oh, that's just nothing but quackery. It's stupid. It doesn't work." And he said, "Well, what do I got to lose? The pharmaceuticals aren't working." Came in and he says, "I feel I'm not 100%, but I'm 80, 90% better." He said they were wrong. And then he went back to the doctor and his dad and said, "Well, why I'm 80, 90% better. Why did you tell me that was wrong? Have you ever had any experience with it?" "No." Have you read any research on it?" "No." "Well, how did you know?" "Well, everybody knows this."
That's what people don't even know, where they get this belief or thought. I'll ask people, those same questions. And I know what happened in the 1970s. You talk about it with the media and went all the way to the Supreme Court, and the chiropractors won.
In the Wilk case.
Yeah, in the Wilk case.
Yes, there was a concerted effort of spreading lies and misinformation. Control of TV, radio.
And we believe everything we hear on.
And we believe. So there was billions of dollars spent to create this perception.
So what steps do you feel need to be taken to change the course of addiction in the United States? That's a heavy question.
That's a very heavy question. The answer is not going to be in disease care. Okay? When you're talking about chronic conditions, pharmaceuticals don't work. You can try to come up with a new drug. You can try to hit that, but disease care is for when the body is no longer working. In about 20% of the healthcare crisis, 80% of all the care needs to be switched over to structure function, and that's the only answer. If you're just playing the wrong game, there are two different games out there. There's basketball and football. And if you're playing football and you try to put the ball in the hoop, you're going to lose. Okay, just simple as that.
Did you make that up just now?
I just made that up right now. You've got to change the game. And the only way that we are going to solve our drug addiction problem and our pain problem is by changing our entire way of approaching it. We have to go to structure function. And people, it's not going to work the other way. As we can see, it's failing.
Right.
It's failed.
So what should our listeners do that have, maybe they're in pain or they have family or friends in pain?
They should seek out structure function care. That should be your first way of working. So finding a structure function person who can provide all the different areas to a multidisciplinary, integrated type of clinic. In our office, we have nurse practitioner, medical doctor. We are very connected on the best diagnostics. So we are utilizing the best of what's available.
So what is the Prather practice doing to stop this epidemic?
We are trying to get the word out there. That's why we have this radio program. We're trying to educate our patients, the public, and fellow physicians to understand that there are other ways of actually approaching this. Our medical doctor came in and he had just injured his knee. And he says, this is really bad. I'm just going to have to take something for it. I said, you don't have to take something for that injury. Come over here, pull up your pants leg, stuck some acupuncture needles in it, took them out, and he says, it's fixed.
Yeah.
He says, how does that work? And, there is just such a mindset on pharmaceuticals, as the only answer.
The first plan of attack.
That finding the alternatives on that just don't cross people's minds. So we need to change people's minds.
How successful is the Prather practice at stopping pain?
Of course, there are limits to everything. But we have people who have been on pain medications for years and years. We've been able to not only be able to work them off of those pain medicines, but also completely stop all the pains where it's down to zero, which they've had for years and years. So we are extremely successful, and it's a matter of implementing all those different types of areas. And as you can get those combinations, you can really get the pain under control.
Now, does the Prather practice help with drug withdrawals?
Yes, we do. One of the things is that several of the people who have been coming in, they were reduced on what their pain medicines and couldn't really see the possibility of going into rehab. we were able to give them products along those lines, auricular. There's different ways of approaching it, and was able to stop all the drug withdrawal symptoms.
Okay, Dr. Prather, we just have a few seconds. I want you to be able to close, because I know this is a passionate area of yours.
Certainly. One of the things that I encourage people to do is to get on our website for further information.
Yeah, pratherpractice.com.
And because we're continually trying to offer education along these lines, and that's what we're here for.
Okay. Well, thank you as always. Let's stop the addiction. Thank you, Dr. Prather.
Thank you.
The Prather Practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. The Prather Practice would like to invite you to a special open house event on Tuesday, June 21st from 4 to 7 p.m. at the Prather Practice, located at 8902 North Meridian Street. If you desire to find a healthy way to relieve pain, restore function, and relieve stress, this is a great opportunity to find services that will help you to feel better and get healthy. You'll learn about our state-of-the-art therapies, including acupuncture, point stimulation therapy, auricular therapy, and chiropractic services. You'll hear a special presentation from Dr. Robert Prather on the importance of relieving pain naturally, and you'll receive a free pain assessment. You'll also get 3 acupuncture treatments for only $59, normally valued at $315. That's the Prather Practice Open House event on Tuesday, June 21st from 4 to 7 p.m. at the Prather Practice, 8902 North Meridian Street, 317-848-8048.